Hello everyone, today we are going to discuss an important question which is related to lower limb anatomy. Whether you are a medical student or you're giving your PLAB exam, USMLE, or if you are giving any other high specialty exam which has anatomy as its syllabus, this question will definitely come. So let's read it. A 28-year-old male is brought into emergency department following a motorcycle accident where his left lower limb was caught beneath the bike and stabilized in the department. Later he is examined and is noted to demonstrate a waddling gait. When asked to stand with his weight supported by just his left lower limb, the right side of his pelvis sags. Which of the following nerves has most likely been damaged? Now, to solve a question, you have to look at the pointers first. What are the pointers in this question? So the pointers are a 28-year-old man, motorcycle accident, left lower limb, then waddling gait, and on examination, the right side of the pelvis sags. So you've immediately noticed that the injury is on the left side, but the right side of the pelvis sags. So something is wrong definitely. And next thing you have to notice is that what exactly is the examiner asking you now? So he's asking you about the nerves, right? If you have a sound knowledge of anatomy, or if you prepared really well, you will be able to pick the answer immediately, and you will know that the examiner is actually talking about a specific kind of gait when he refers to waddling gait, and that is known as the Trendelenburg's gait. So if you know about this gait, you will definitely know about the answer as well. But if you do not about this know about this gait, so what we can do is we can now use the exclusion method to find the answer. The exclusion method is that you are going to cross out all the extremely irrelevant options. So you have two options to decide from. Now, femoral nerve, sciatic nerve, and obturator nerve are the options which are extremely irrelevant. Why? Femoral nerve is the nerve of the anterior compartment of the leg. So it does not have anything to do with the pelvis, right? Sciatic nerve is the nerve of the posterior compartment of the leg. Again, it supplies the muscles of the posterior compartment like hamstrings, not the pelvis itself. Obturator nerve is nerve of the medial compartment, and it is the nerve which supplies all the adductors. So this is also not an option for us. The last two nerves which are left are the superior gluteal nerve and the inferior gluteal nerve. So let's focus on these two nerves for now. Okay, so now we have to choose between these two nerves. Now for me, I have tried to memorize this using a certain vague idea in my mind. Everybody has mnemonics or certain absurd ways to remember a thing. You can remember it by its color, you can remember it by making a picture in your mind, you can make a good mnemonic out of it. It's all up to you. So I have learned it in this way, that the superior gluteal nerve is the larger nerve because it's superior. It says it's superior. So now if it's superior, it means it can cater more than one muscles. So it supplies two muscles, that is the gluteus medius and the gluteus minimus. So the superior nerve has taken this duty or responsibility to take over the two younger ones, the medium and the minimum ones. Whereas opposite will happen for the nerve that is left. So automatically this means that the inferior gluteal nerve is going to supply gluteus maximus, because only this muscle is now left. Here we're talking about the glutes only, the muscles of the pelvis, because we know that only the muscles of the pelvis will have a role or something to do with the pelvis sagging, just like it was mentioned over here, right? So this is how you look for the answer when you do not know anything about it. But if you actually want to know what happened here, is that they're actually talking about Trendelenburg gait. So it's a specific kind of gait. Here we can see Trendelenburg gait. Trendelenburg gait is actually, or Trendelenburg sign, sometimes it is known as that. It states that the muscle with the weaker side is going to let the pelvis drop on the opposite side. So you can see that here they're pointing towards the gluteus medius on the right side, and this is the gluteus medius on the right side, and the pelvis is falling on the left side. Similarly, here's another picture. Let's see in this one. Okay, this one here, right? So this one, it states that again there is weakness of the right gluteus medius muscle, which was being supplied by the right superior gluteal nerve, and now there is a lesion in the right superior gluteal nerve, तो ये opposite side पे गिर गया जाके. There is a left pelvic drop. This is basically what the Trendelenburg gait is. Now you know how to approach a question and what Trendelenburg gait is, but it is important that you go and read it in detail. Basically, the gluteus medius and the gluteus minimus muscles are the abductors, and abductors, they pull something away. So if abductors of one side are not functioning, they are not able to pull the pelvis away once we pick up the foot from the opposite side. So the pelvis falls to that side. It is easier said than understood, so it is better to read the text in detail, and then we can figure out this answer, that how we reach to the conclusion of the superior gluteal nerve. I hope you like this, and I hope you understood it and found it useful. Please do let me know in the comments below. Thank you.